What should folks consider when they're deciding whether to report PI at the provider level, the TIN level, or at the APM level?
Oh, good question. Very good question. I think the APM has a big stake in this. Again, I think failure to have a valid submission applicable to each of the participants can affect your ability to collect on your shared savings. So there's a big role there to play, and I think so. I think APM's making a submission is a great idea, just to take control of it and make sure you don't have individual providers or small practices, participants neglecting this and affecting the whole uh, the whole group. Now, and there's this is yet to be shown with time with how Medicare handles it, but there's an advantage when you move from an individual submission to a group submission. Some of the measures that are attestation based or that require just one not, numerator instance to pass, the whole group takes on that. So if you have only one who's made that connection between patient and EHR, that has one that's complying with the referral based interoperability, that can apply to a larger group. So I think there's that advantage that you gained for the whole APM. Now, the downside for the individuals, for the practices and groups, people are doing a great job and would get a higher score alone or as a group, may get a lower score as an APM, but there's no reason you can't do both. And we have increasingly people submitting quality submissions that will do an individual submission or when the group is not getting as good a score as they would be getting. So rather than accepting the group score, they make an individual submission to get a bigger MIPS, a better MIPS adjustment. So that can happen here in the APM PI level as well. Now, for your advanced APMs, there's no other advantage of getting a PI score. It doesn't go into any kind of an adjustment if you're a qualified participant. But if you're a partial QP electing to participate in MIPS, or a MIPS APM who you're all participating in MIPS, it can make a difference in your adjustment if you accept the APM level score or make your own individual group submission.
I see. So there are really two things to consider, it sounds like. Everyone should be concerned about satisfying the shared savings requirements.
Correct.
And your non-QPs, meaning your MIPS APM folks or MIPS eligible providers, might see a negative adjustment if they don't successfully earn those points in the PI category.
Correct. And of course, you remember that the danger is always there for a negative adjustment. So putting your own better PI submission in might earn you a smaller negative adjustment, or perhaps move you into the positive range. So you have to think about the whole range as you're thinking about that potential for the year.
Yeah, that makes a lot of sense. As you mentioned, I know a lot of providers might choose to make an individual submission in the quality, PI, and IA categories because their own score would be better than that of the group. It sounds like that might be a good strategy for providers or TINs to think about if they think their own score would be more successful than the score that would be achieved at the MIPS APM level.
I think you've nailed it, Bridget.